Hello, everybody. Happy Monday. Thank you so much for joining me. As you are joining me, I want to tell you about a special guest, Dr. Karen Dobal. She is an emergency room physician. She is a colleague. She is a friend. Hi, everybody. Thank you for joining me. We were having a great discussion this morning, and I was inspired to have her on tonight live. She is a wealth of information, and in a few minutes she's going to request to join us and share her wisdom and her knowledge and her current experience with COVID-19 and give her views also as a mom of 3 daughters with a husband, working full-time in the emergency room in Miami, and a very busy emergency room in Miami. And she is, again, Dr. Karen Dobal, colleague and friend, and we're going to talk about COVID-19 this evening. What is the latest? Hi, everybody. Thank you. She's going to be asking for a request to join. I just spoke to her a few minutes. It is her first time, and I'm so grateful that she said yes when I asked her that she was okay with doing this with me, because I do respect and admire her opinion greatly, and I believe there's value in sharing what she's experiencing currently in the hospital, in the emergency room. So as you know, I'm a primary care physician practicing for 23 years. She and I have known each other since medical school. And she went on to be an ER doctor, and I went on to be a family medicine physician. And so, let me see here. She's going to join us any minute now. I told her to look for a little request to join the live. So she'll be joining us any minute. So if any of you are just joining me for the first time, as I said, I'm a family medicine board certified physician practicing in Pembroke Pines for 23 years. Our office is open. We are practicing protocols as if, there she is. Hi, she's coming on. She's going to join us very soon. Here we go. Dr. Karen Dobal. Here we go. She's going to join us any minute now. So here we go. We're connecting. Hi,
Hey.
there.
Hi, how are you?
Welcome, Dr. Karen Dobal.
Hey.
I was just introducing those that have joined us so far, who you are, how long I've known you. You can take it away, tell them who you are, where you practice, or not even where you practice, honestly.
Yeah.
I told them you're an ER physician in Miami,
Right.
and that we've known each other since medical school, that
Right.
we are colleagues and we are friends, and that I respect and admire your opinion and everything you're about to share with us this evening. I loved our conversation this morning. I told them you're a mom, a wife, you have 3 daughters, and just how you're handling all of this and what you're seeing in the emergency room, and maybe some of the things you feel we should all know that maybe we really don't know and realize, you know?
Right.
You can
Yeah.
just talk freely.
Yeah, there's a lot of information. So I've been practicing emergency medicine for 20 years in Miami. I work for one of the big hospital systems down here. I don't want to mention it because I'm not representing them. I'm just representing me, a mom, a doctor, with some information. Just want to share it. There's a lot of things that aren't known and people are very nervous. So I just wanted to start with just a casual conversation about COVID. So again, I wrote some stuff here for myself to remind me so I don't forget. Things are changing pretty much daily, what we know. So what I'm telling you now is what I know, what I've learned from doing continued medical education. I've done over about 15 hours on it, dealing with COVID, as well as following different people on YouTube, mainly intensivists. Those are the physicians that take care of the critically ill patients in the ICU. And I don't follow the CDC. I don't follow the WHO. I find that they have conflicting information, and a lot of times at the exact same time. So I like to, hear from other practitioners who are taking care of these patients and, learn from them what they're experiencing, what their thoughts are. So that's what I'm going to share with you today. One of the things that I learned, and again, I don't profess to know everything. And,
Right.
I think one of the things I learned in med school and in my residency is that the more you know, the more you realize you don't know. And that's
Right.
definitely true with COVID. COVID is so stressful for us because there's so much we don't know, and we're still learning as we go. So if you're getting conflicting information, it's because we're still learning. So,
That's right. That's a good point. Thank you. And
yeah,
so that instills like this fear and this anxiety, right?
right,
So thank
right.
you for joining us so that you can give us your perspective.
Right. Well, I think that's very important because I think there is a lot of fear, there is a lot of anxiety. And one of the ways that I kind of counteract that, being a mom and, having family and friends and people I care about that I'm concerned about, I use knowledge to help me, calm my nerves when I'm kind of nervous about what's going on. And as I'm taking care of these patients, some of which are very, very sick, but the majority are not. So one of the things I'd like to start with is the data. There's so much data out there. What do you make with those numbers, the test results, the numbers are increasing, the death numbers, what does that all mean? So, and we don't really know because we don't know if how they're really registering those numbers, those positive tests. We don't know if those are people that are getting retested to see if they can get their double negative that everybody's looking for once they're positive, to see if they can go back to work or go back and be exposed to family members and people they care about that are at risk. So we need to discuss how to interpret the numbers. One of the things I need to say is in the beginning, we weren't testing as many people as we are now. In the beginning, we were testing people solely with certain risk factors, specifically that they had symptoms and that they had travel history or an exposure history. Now we're not doing that. We're testing anybody that gets admitted to the hospital, anybody that's getting a procedure or surgery, and anybody that comes from an ALF, which is an adult living facility, or a nursing home. So the number of people that we're testing has multiplied. So of course, the big thing with this COVID virus that we've noticed is that there's a lot of people that are positive that don't even have symptoms. And the vast majority of people that are positive don't have symptoms, or they have maybe mild cold symptoms. And then there's that small percentage that we don't know why, but they seem to get really, really sick. And those cases are indeed horrific. But again, the number is very, very small. But that's what's in the news, and everybody hears it, and everybody is, understandably very afraid of it for themselves and for their family members and friends and people they care about. So interpreting the data. Again, so the numbers, are we really having a surge because more people are getting infected? Or are we having a surge because we're finding out more people have it and we didn't know that before because we weren't testing them before? The other thing is again, are those people that are being tested twice, are they also included in those numbers? So, and then the other thing is you see a lot of, tests and research coming out about different medications, different treatments. Again, interpreting the data. So one of the ways that, I was always taught in my residency to interpret the data is you look at the study. First of all, who did the study? Are they biased? Who's funding the study? Because that obviously would show a bias. How many people, which is so important, the number of people, because really if you have, double digit or triple digit numbers, you really don't have enough people to say what you're saying, regardless of what the results of the study are. You really need several thousands of people in your study, double blind, placebo included, to say that whatever you find is really a valid finding or not. Because otherwise it's a coincidence and it's a flip of the coin. So that's very important when you're interpreting the data. And I find that, when I go back again to where do I get my information from, one of the persons that I really like to follow is this guy on YouTube. His site is called Medcram, MEDCRAM. And what I love about him is that he gives you data, and he gives you the articles, and he gives you what journal, what year, so you can actually find those journals. And a lot of time he'll actually post those journals so you can actually read them for yourself. I find any article that quotes an article but doesn't put that as a reference where you can look up that article yourself, then that's just not, I would not believe what that person is saying, because you should be able to reference that article and look it up and read it for yourself. So so that's interpreting the data. And let's see. So as I'm talking today, I want you to listen to what I'm saying, chew on it, savor it, and then either swallow it or spit it out. Okay? Because again, the reason why I say that is because, there's a good friend of mine who's very sweet, sent me, an article about another physician who got reported because he was spewing lies. These are the facts as I know them that I'm sharing with you. And you may not agree with me, and you don't have to agree with me. But again, I'm just trying to share information so that when you see information, you kind of take it with a grain of salt, and also, maybe see where's the information coming from. Is there an ulterior motive? Because I do feel that there's a little bit of a scare tactic going on here.
Right.
And my whole goal is that people aren't scared, that they're educated, and with knowledge they can live, a new kind of normal in this crazy world that we have right now.
Yeah, like you said, knowledge is what helps you manage the anxiety and the fear, right? It's when we don't know, when we feel disempowered, that we feel anxious and scared and worried. So thank you so much, because I agree with you. Thank you for showing the knowledge that you use, right, in the ER. You're in the front lines. You're seeing patients that are COVID-19 positive, and you go home to your family. Can you share a little bit how you, unless you want to finish your notes first?
No, I just have a bunch of things I just jotted down just to refer to. But, the funny thing is that when you see a COVID patient, they don't look sick for the most part. The vast majority of them do not look sick. So you have to gown up, you have to take the appropriate precautions to evaluate them and take each one seriously. Because they have the nickname, we call them the happy hypoxic, because one of the big things is that their oxygen is very low.
Right.
But to look at them, you wouldn't tell, because they don't exhibit the typical symptoms of somebody who's short of breath, where they're breathing fast, or they're, where they're using their muscles in their neck or their stomach to help them breathe, or they're sitting up in that tripod, position that we hear about when somebody's in, respiratory distress. They're not. They're on their cell phone talking, and they're totally fine. It's only when you put a pulse oximeter on them that you see that they're 90, 88, or whatever.
Right.
So you can't look at somebody and say, oh, that person's positive for sure. That's just not true. You can't tell. So you have to assume, in my opinion, that everybody is positive.
Right.
Okay. So what does that mean? So you have to take the proper precautions. I work in an ER. I definitely see positive COVID patients every single shift I work, as do my colleagues. So what do? We do the proper precautions. We wear a mask. In my case, it's an N99. Mine is N99, which is because I do procedures. So, I need the extra layer of protection. But, N95 is, what some people use, or regular surgical masks, or the cloth masks. Washing your hands frequently, and also, keeping social distance, separating yourself. Now, so then so what do? What's safe to do, And it's like, there's some people that are just so afraid they don't want to leave their house. And that's obviously no way to live, because we've been dealing with this since March, and who knows when it's going to be finished. So you kind of have to realize that there are certain measures you can take, but everything has consequences. You hear the people that don't believe in the masks and they don't wear masks. That's really not something that really, I see people getting upset about that when people decide they don't feel like they have to wear a mask. Well, it really doesn't affect you if you're wearing your mask, you're doing the social distancing, and you're washing your hands, and also disinfecting surfaces like your phone and the door handles and, and stuff like that. It doesn't really affect you if somebody else is not wearing a mask. Okay. So I think that's really important, because people freak out. But if you're wearing a mask and you're doing what you need to do, then you're okay. And again, you need to decide, am I going to go to Target? Am I going to go, see a friend of mine, being responsible with my behavior? You can't be a hermit, because the other problem is that you have depression. You have the mental illnesses that come out, and you have depression. It's like a situational depression, which affects a lot of people that aren't depressed, don't have a history of depression, but now they're situationally depressed because they're socially isolated.
Right.
And it's very debilitating, and it's a huge problem.
And that lowers your immune system.
Right. So, so we need to, the other thing we need to talk about, since you mentioned the immune system, is, what do you do, to help yourself? And one of the things I do is you try to boost your immune system as best as you can. Vitamin C, vitamin D, either taking it orally or going out in the sun for 30 minutes. I like to take Align probiotic. It's a pre and probiotic.
Right, because your gut helps your immune system, right?
Your
you have to have a healthy
is
gut.
so important, which is why I'm also not a fan of prescribing antibiotics. I do prescribe them, but again, your gut flora is super important in protecting your immune system and helping you fight disease. The other thing that we talked about earlier, I was talking to you about, was the hot and cold showers.
Yes, tell everyone about that.
Yeah.
That's
So
really really been proven to be true to increase your monocytes, right?
Yeah. Yeah, it's very easy to do. And again, these are things that you can do that the, risk of adverse reaction are very small, versus the benefit. So things that you can do are the shower. It's the hottest you can tolerate for 5 minutes, and then alternating with cold for 1 minute as you can get it. And then back and forth times 3. The other thing you can do is you can go in a jacuzzi 5 minutes, into the pool 1 minute, back and forth as well. They heard in the beginning, it was funny, in the beginning of this whole COVID thing, you heard about people blow drying their nails. They were, and it was because they were recommending, I believe in Europe, to sit in a sauna. And so people thought it was the heat in the air, in the nasal passages was killing the virus, but it's actually, increasing your body temperature increases your monocytes, which is part of your innate immune system, which helps you fight infection. So those are things that you can do as well, to help yourself fight this virus that we're
So that's great tip. So that's what you do when you get home from work. So
absolutely.
Everybody out there, when you go to a workplace and or you go out and you're out with other people and you're interacting with other people, when you get home, it's recommended you take off your uniform, whatever it is you wore to work. In my case, it's my scrubs. My staff, it's their scrubs. If they go to an office, whatever they were wearing. Take it off, put it in a bag, plastic bag, and along with their shoes. Take everything off, and then go take a shower right away, and do the hot and the cold, alternating for 3 times. The cycle of 1 minute cold, 5 minutes hot, 1 minute cold, right? 5 minutes hot, to boost your immune system on a daily basis, because it's what we do every day that really counts, right? And the prevention is the key, right? We're going to definitely talk more about that.
Yeah.
But we need to have that process. I know that you shared that with me today, that you actually have, you have these gowns donated by Ford. I was looking it up today. Ford recycled some of their tires. Can you share a little bit about that?
No, it's their airbags.
You were able to wipe it down?
Yeah, the airbags. So we use those when we have patients that are positive, that we gown up the full, the goggles, the N99s, and the shield, and then the impermeable gowns. And Ford was nice enough to recycle their airbag material, and it's great. It's impermeable, and we can wipe it down if we need to. Okay. So, I mean,
I'm trying to give a shout out to Ford for doing that.
Yes.
I believe they donated those gowns, and they're donating a lot, I think, to different hospitals.
Yeah.
And recycling old airbags, right?
Right.
So, but anyone out there, you can come home as a precaution, change, take a shower, do the 5 minute, the 1 minute, take your vitamins, rest, wash up, clean everything down on a daily basis, right? Use
and just a bleach, 1 part
bleach
to
solution.
1 part bleach to 9 parts water, and just wipe down your counters, wipe down your doorknobs, the light cell phones, so just get in the habit of doing that.
Right.
Yeah, because people are like, oh my gosh, the Lysol, I can't get my hands on the wipes, on the spray, but the bleach works perfectly. It doesn't smell too good, but then the bleach does go away, and it also is reassuring when you smell that smell that, hey, not much is going to survive that. So let's see what other things that I had mentioned. Okay, so again, why are we talking about this? And again, things that you can do to help yourself, protect yourself, and protect other people. And I think that it goes back again that, nobody is wrong in what they do. It's like what I always tell my patients in medicine. It's like, everybody knows, at least in South Florida, how to make arroz con pollo. Not everybody makes it the same way. It doesn't mean it's wrong. It's just different. So you just need to do what is you're comfortable with, what makes you able to live that new normal, that we are now all in, and so that you can sleep at night, and so that you're not constantly afraid and petrified that you're going to get it or you're going to pass it on to a family member, which is what I constantly hear, those concerns. So that brings us to testing. The testing. There's the testing for the virus itself, which is the PCR, and that's the nasal swab. And the theory behind that is that the viral load is very high in the back of your nose, or your nasopharyngeal area, which is why they stick that Q-tip back so far and so uncomfortable.
It hurts.
Yeah, it hurts. It hurts, yes. Now, the reality is you can do a nasal swab inside your nair or inside your mouth, but the thought is that the viral load is higher in the back of your throat, so that's why they try to get back there. So And then the blood test would be for the antibodies, and that would be to see if you had had it or if you have been exposed. Because again, there's a lot of people that don't show symptoms, or they show very little symptoms. And by the way, it's not cold or flu season right now. So if you have cold symptoms, you probably have COVID. And the majority of people will be fine. They just have body aches,
Just
maybe a
stay
sore
isolated,
throat.
right? Isolate
Yeah.
yourself.
Again, stay isolated. And again, wash your hands, wear the mask, and stuff
Social,
like that.
and within the home, if someone is COVID-19 positive, what do you recommend?
We recommend that they stay in a room by themselves if they can, and also with their own bathroom. And again, everybody wearing masks. It's difficult, but everybody wearing masks, washing hands frequently, and wiping things down.
Right.
So somebody's asking if it would be in the saliva. Yes, it is in the saliva. It's just the other problem that we're having with this is that you'll hear people who have symptoms who are coming back negative. Again, it's not cold or flu season right now. And then they might get checked maybe a week later and they turn out positive. So that's a weird thing that we're kind of experiencing as to if it's so contagious and if it has such a high viral load, which is what everybody believes, why are people coming back negative? And that's very, we can't explain that. I mean, we think maybe there's a testing period that, a window where maybe whatever the PCR, which is the test they use for testing the nasal swab, maybe the spike protein isn't present, and that's why they're not recognizing it. We don't know. And then they hear the people, oh, they tested negative and then they tested positive. They're thinking maybe that they're picking up viral particle, but not the virus. So therefore they're not contagious. So again, like I said, it's super not clear.
Right.
It's been the most unnerving thing that I've experienced in my career. It kind of reminds me when I first started with HIV, where we didn't know what was causing it, how it was spread, a little bit of the same kind of thing, and everybody is kind of trying to work through this.
Right.
So, and then somebody I saw asked, about the contagious, and the thought is, again, you're going to hear different things. Some people say that they're most contagious when you don't even have symptoms. Again, the thought is that there's such a high viral load that even just talking or singing can cause the spread of the virus. Not like the normal cold, normal flu, where you sneeze and you cough and you aerosolize the virus. So, so
that's where the mask comes in. Wear your mask.
Yeah, and we're also kind of noticing, and there's actually a lot of things that you'll see on YouTube where they'll demonstrate, what looks like when somebody's talking, when they're singing, when they're yelling, when they're screaming, with and without the mask, So, okay, so I have a few questions here about what about the possibility of the vaccine. The only issue with the vaccine is, everybody's saying, oh, we can't wait till the vaccine comes out. But the reality is that it's an RNA virus, and we haven't really had that much luck in finding vaccines for the RNA virus. You'll notice with the flu every year, it's a guess because the flu is always mutating. So it's always a guess. So sometimes we'll have a bad year where the guess wasn't very good. So people will get sick anyway. We always recommend you get the flu anyway, even though it's a guess, the flu vaccine anyway, even though it's a guess, because several reasons. One, if you do get it, the symptoms should be less severe, and people do die and do get very sick from the flu, especially the young and the old. And then also the thought is also that maybe some people are not getting as sick with this coronavirus because maybe they were exposed to another corona, because there's several different strains. This 19 is a new strain of corona, but we've had corona for a long time. So they're thinking some people may have been exposed to corona. And then also other people are thinking that maybe, okay, the flu vaccine isn't specifically for COVID, but maybe some people who are consistently get it, the flu vaccine, maybe they have some immunity built up.
There might be some cross immunity, right?
Right. I mean, the whole thing, this is what your immunity is, basically your army. And what the vaccine does is it exposes your body and kind of gives your body a taste of what the enemy tastes like, what the enemy looks like, so that when you see the enemy, then you can then attack it and build up you have your army already ready. It's kind of knowing, for example, that your army wears, red and black, so then if you see something with red and black, you're going to be suspicious. If they have a red and black jacket, you kind of already know what to look for. So you kind of say, oh, there's a red and black jacket, let's call the troops, and then let's, guard and then defeat if we need to. That's what your body does, your immune system does. So that's why they're saying that maybe, the flu vaccine gets your body kind of revved up, And And then somebody's mentioning about the specific blood type that gets worse symptoms. Honestly, I know there's studies on that, but unfortunately, again, this goes back to what I was talking about before. The studies don't have enough numbers to say what they say. So, again, it's just like, flipping a coin in those instances. Because then you can't say that it's truly a result of the blood type versus just a fluke of that test. And I'll give you an example, like the aspirin. When they did the aspirin studies, several decades ago, the results were, and it was against a placebo, and the results were so impressive that they had to stop the study. So that's been my argument with the Plaquenil and all these medications. It's like, if, we've definitely had the numbers in Italy, in Spain, in United States and New York. If these drugs were the miracle drugs, you should have seen, a very impressive, like, my goodness, you give these people these meds and they do phenomenal, So, but we're not really seeing that. So you can't say in this case that we don't have enough people to study. We certainly have had enough people to study, unfortunately. So that's, but then again, if I have somebody who comes in that's really sick, I'm going to give them everything, because this is not a respiratory virus, which is what everybody thought in the beginning.
Yes.
It enters the body through the nasal oral passages, and it attacks the lungs, but not like we thought it did, which kind of explains why the asthmatics, the COPDers, the emphysema patients aren't getting as sick like you would think that they would. And also why, the patients weren't responding to the treatment we were giving them. And it just didn't make sense. And then what it turns out is actually that this is more of it attacks the blood vessels, the inner lining of the blood vessels, and tends to make people hypercoagulable and tends to give them a vasculitis type of picture, which would explain why you're seeing the strokes, the heart attacks in the 30-year-old patients, the kidney failure, and you're seeing there's like about 5 or 6 different rashes that you can also see with this. And again, it's because of the vasculitis that they develop. So it's been a fascinating virus as far as that's concerned. And, because like I think I told you that story earlier about that young gentleman who was having a heart attack, and he went to the cath lab, they removed the clot, which ends up being like a noodle, and they always measure it. And as he glanced up on the monitor, and as he did, he saw another clot forming. Right. And then you'll also hear like people on dialysis, how they go on dialysis and they just start clotting. And it happens in a very, very small percentage of patients, but when it does, it's horrific,
Right.
So,
And they don't really know why it happens to some people and why it doesn't happen. What do you know, or what can you say about that?
Well, they have been studying some people, and they have noticed the fact that, people who are obese, people who have diabetes, people who have heart disease, those are the people that are really affected by this, people who have high oxidative stress. So it's, so those are the people, because you'd think, you think that normally it would be like an asthmatic or a lung person, or you'd think it would be a cancer patient, but it's not. They're not the ones.
What would you say about anyone that's taking Plavix every single day chronically? Do they have some level of protection or some other anticoagulant?
In theory, I would say probably. I don't know, because again, what this definitely does, it does make people hypercoagulable.
So you're an anticoagulant.
Right. Mm-hmm.
What do you say about that? What would you?
And they do.
What's your educated
assumption
about that?
What we usually do is we usually give them Lovenox if they have normal renal function, and if they don't have normal renal function, then we put them on heparin. So
you're using an anticoagulant. What's your treatment? Like, what have you been doing in the hospital or in the ER?
Now we're using Decadron. And, and it's funny because we found also that they do better when they're fluid restricted. So in the beginning, it was really difficult because they were saying, don't give fluids, don't give steroids, you don't give nebulizers. But don't give, still now, you still don't give fluids, you don't give nebulizers because you contaminate the whole environment if you give a nebulizer. So when you had an asthmatic come in, you're like, what do you do with these patients, because you have no treatment to give them? But now they're saying that they found that Decadron, which is a steroid, does help people, but we're still not giving nebulizers, so
so we definitely are not doing that. Talk about that for a moment, because I also have a family practice, so I've decided also to stop doing the nebulizer, because you aerosolize, you could potentially aerosolize the virus, right?
And,
so
that's
you're not doing nebulizers anymore.
And that's or in the hospital period. And that's across the board. I mean, even when somebody has pneumonia or somebody has tuberculosis, it nebulizes, meaning it aerosolizes, meaning it puts whatever the bacteria, the tuberculosis, the whatever, it puts it out in the air, you know? So, and I see somebody's asking about the aspirin, the daily aspirin. It's difficult to say about the aspirin only because, like, for example, like you're not supposed to take any non-steroidals. Non-steroidals would be like Advil, ibuprofen, because the reason why they're saying with that is because of the fact that it decreases your immune system. I'm reading these comments as well. Okay, so I'm not sure about the aspirin. I don't know enough about the aspirin. I personally take aspirin every day, and I think unless you have asthma,
do you take,
I take 81 milligrams every day, and I take it, you know,
coated?
because, yes, I do take coated baby aspirin, that because it does have a direct caustic effect on the stomach lining. So I take 81 milligrams, and if I fly, I'll take 2 or 3. You know, the 81 milligrams. I'll give myself a little booster. You know, things that are like, or if I'm driving along, like I'm driving to Orlando or doing something that's high risk for clots, I'll take a little bit more. So,
okay,
and then,
that's a great tip.
Yeah. So somebody's asking about the vitamin D. Vitamin D, absolutely. What vitamin D does is that it improves your immune system. Again, you want to improve your immune system to make yourself ready to fight, because that's what this basically is. And so what am I doing? I definitely am taking the vitamin D.
Me too.
Yeah, I take it. And
you can
also,
take, how much do you take, Doc?
I take 2,000, but you can.
Yeah.
I've read places where you can take up to 5,000. You know, obviously, you know, you need to.
You have to get your blood work checked.
Right.
So everybody out there, get your level checked. I found I was deficient, so I take 5,000. You know, your doctor will tell you whether you should take the prescription strength, because there is a megadose prescription strength if you're below 10, for example, which some of my patients are below 10. I mean, we have to correct nutritional deficiencies so that you can have, if you're exposed, your immune system will be able to function normally in a healthy fashion, and you'll have a mild illness, right, Karen?
Right, and actually, this is a good plug for you and what you do, because you do believe in the treating the whole body and the hormones, and sometimes people can be therapeutic, but they're not really, you know, clinically therapeutic,
and
that's your forte,
checked, right?
Yeah, and that's your forte. You do that. That's what you do. So, you know, people can look you up and get their labs tested and have, you know, you evaluate them and see if they're actually maybe clinically low, you know.
Right.
So,
quite
you know,
common, yeah. So that's a great tip.
Right.
Vitamin D is a factor when we.
Right. Somebody's asking if, you know, vitamin D deficiency, is it a factor in Florida? And it surprisingly is. It surprisingly is, and it sounds crazy. And the reason why it is because everybody's wearing sunblock. Everybody is avoiding the heat. So it's surprising. Think about it. Think about it in your life. How many times do you go and spend a half an hour outside? You don't. And if you do, unprotected, right. And you know, we've all been, you know, lathering ourselves up in SPF to avoid the wrinkles and the dark spots. So the high blood pressure. The question is, how about high blood pressure? High blood pressure is considered in the realm of heart disease. So yes, you need to, you know, make sure you are technically at risk, and you need to make sure that you control your blood pressure. There's certain things that you should have, in my opinion. You should have a blood pressure cuff at home, because of the fact that, for the most part, you know, people say, oh, I have a headache, my blood pressure must be elevated. No, a lot of times you can have high blood pressure and have no idea and have no symptoms.
Right.
So you need to check it. You need to check it, you know.
Great advice.
Yeah, so you know, what can you do about that? You know, my recommendation is that you record it. You don't get neurotic, because there's several things that can falsely elevate your blood pressure, like being angry, being upset, being scared. Those are a lot of things. Oh, look at that. Saying I'm here thanks to Dr. Pages.
If you're my patient, you have a blood pressure cuff at home.
So, but you know, there's things that you can do. I mean, you know, it's interesting because, you know, hypertension and diabetes, if you don't take care of yourself, you will suffer consequences. There's absolutely no doubt about that. And it's interesting, you know, low salt diet, exercise is really good. It's like making your body a well-oiled machine. And you need to monitor what you eat. You need to, you know, avoid preservatives. A lot of preservatives are salt-based. So, you know, and that includes fast food, you know. So, you know, you need to monitor your blood pressure, write it down and check it. Yes, volleyball tournaments can definitely elevate blood pressure, cause anxiety, cause migraine headaches, ulcers.
Has 3 daughters.
Yeah, that play volleyball. Yeah. So I think they should have like Ativan misters at some of these places. That would just chill everybody out. But going back to the blood pressure, like I think you should monitor, because it affects your eyes. It can put you at increased risk of strokes, increased risk of heart attacks, increased risk of renal disease, renal failure. And that's not something that you feel. Your kidneys aren't going to hurt, you know, so you need to check it so that you're not getting the damage. And the reason being is that if you check it, it's something you can do. You can treat it. And there's a lot of people that I've seen that like, oh, they're so upset because, you know, they have to take medication every day. And I'm like, listen, there's plenty of people that I see that would love to have a pill to be able to take it every day and take care of the problem. You know, and obesity is a classic example of that. There's people have been looking for that magic pill for decades. So, you know, you just need to do what you need to do, you know, yeah. And I always tell people, you know, don't get discouraged because nothing lasts as long as we do. Cars don't last as long as we do. Refrigerators don't last as long as we do. So go see your doctor. And that's the other thing I always tell people, you know, it's, again, going back to that arroz con pollo analogy I gave earlier, you know, not everybody makes arroz con pollo the same way. It doesn't mean it's wrong. You got to find the person that makes it the way you like it because you have different philosophies. Some people are more laid back. Some people are more, you know, so you need to, you know, find that person that you click with so that when you have a serious condition where you need to go on a dangerous medication or you need a procedure, you trust the person who's giving you that information and tell you that you need this. You don't want, because I've had people say, oh, my doctor's an idiot. I'm like, well, not the only one, because you shouldn't be with them if that's what your opinion is of them, you know? So, and then with the diabetes, you know, again, it's going back to self-care.
Right.
You should be monitoring your sugar because diabetes will 100% cause you to lose your eyesight, cause you to have a stroke, cause you to have a heart attack, cause you to lose your toes, and cause all kinds of major badness, which initially in my residency, and I'm sure in yours too, that we thought that was just an inevitable, you know, you were going to get one of those complications. But thanks to gastric bypass and the significant weight loss, which has gotten rid of diabetes and hypertension in a lot of patients, we find that actually diet is super duper duper important.
Right.
So that's
food
a little
is definitely food is medicine.
Yes.
Just cut out the crap. You know, that's key, the prevention aspect. But getting back to you, Dr. Duvall, you are in the emergency room.
Right.
What has changed in the emergency room? What's going on? To recap, the counts are going up, the cases are going up because more people are getting tested, right? Even a patient of mine, she had to get tested to travel to Jamaica. So also when you're traveling somewhere, you're having you show that you got tested.
Within 10 days. Within 10 days.
Yeah, exactly. So, and like you said, people are going back and getting retested. Like there's people working in pharmacies and they're getting tested once a week. Hospital, how often do you get tested, Dr. Duvall?
I don't get tested. I've gotten tested for the antibody and I was negative. I don't believe in the testing, and I'll tell you why. There's certain, obviously, like you mentioned, there's certain instances where you definitely need to get tested, like to travel in certain jobs. And then also, you know, if you live in an ALF, which is an adult living facility, or if you live in a nursing home, you definitely need to be tested, or if you're having a surgical procedure. But the reality is that the problem with that test is a lot of times you may have it and it's negative, so it's not really reliable. And the other problem is that the way it is now, that so many people want to get tested that you get tested and you don't find out for a week what the result is. Well, you go get tested in the morning, that afternoon you went to Target, you went to go see your mother to bring your mother, let's say, some you know, medications or something that they needed. You've been exposed. So, you know, that makes that test really invalid. It doesn't matter if it was
you don't
negative
get tested. How about your husband, your kids? How are you handling that? They're not getting tested. So what do you recommend? Like so you're thinking it doesn't really make sense. For you, it doesn't make sense because you could give the example of that. For example, if you get tested today.
Right.
What's
Again,
the scenario that doesn't make sense to you?
Because if I got tested today, the likelihood is that I won't get the result for a week.
Right.
So meanwhile, you know, I'm going to go to Publix. Okay, let's say I'm not even going to Publix. Let's say I'm having it delivered to me. That's still an exposure. So, you know, or let's say, you know, my mom comes over, you know, that's an exposure. Every interaction is a potential exposure, which makes that potentially negative test that I took this morning not really valid anymore, because that test is for that moment in time. It's not predictive for the future at all. So, you know, that's why I find a lot of people getting hooked up. I got to get tested. Well, you go get tested and then you're waiting for a week, chewing your nails, wondering what the result is. Well, meanwhile, you've been exposed, or maybe you got tested in the wrong window and then you have symptoms later.
And so what do you recommend?
You know, again, I recommend that you kind of assume that you have it. You assume that everybody around you has it, and you act accordingly. You know, you act accordingly. You wear your mask.
So when you go see your mom, how old is your mom?
My mom is I'm not going to give her the exact age. Okay. I don't know if she'd be upset about that.
She's considered over 65.
Right. And just for the record, I've been 27 for like the last 3 years. Okay. So anyway, my kids are like, so what year were you born? I'm like, 27 years ago. Do the math. So anyway, but yes, I mean, that's a very valid point. So another example, again, so the other thing I say is that, okay, so I give all these recommendations. And again, I strongly believe that, we live in America. It's a free country. I don't get upset if somebody doesn't wear a mask. That's their problem. I'm protecting myself. I think they should, but I'm not going to get upset about it, and because I think there's consequences. There's consequences to every activity. And I try to teach my kids that there's good consequences and there's bad consequences. So, my kids, for example, my kids are doing volleyball. They wear the masks, they wash their hands. There's a very small group of girls that go. And, some people might think I'm crazy. I understand. But you know what? Ever since I saw that story about the 13-year-old who had no psychiatric illness, who killed himself, I was like, you know what? This isn't worth it. My kids, they need something to do. Yeah, they need something to do. And it's amazing when we started having a schedule and having to be a certain place at a certain time, the whole family was in a much better mood. It was now our lives revolve around that because there's nothing else going on. There's just and that's a choice that we make, and, when I'm at work. Yourself. Yeah, but when I'm at work, when I get to work, I put my mask on in my car and I do not take it off until I leave. I don't drink, I don't eat, I don't take it off. So, there's some people are like, how can you do that? I'm like, because I need to be able to come home, get undressed in my garage, leave everything in the washer. And I also, when I leave the hospital, I wipe my shoes down with the bleach, So I need to do what I need to do so that I can come into my house and not worry about contaminating my house, my family, So, and that's what I do to make me comfortable. But on the other hand, I go biking with my kids. I do go out. I don't live in my house 24/7. I don't. Right. But realizing that there's always going to be exposure. There's always going to be a potential risk with everything that you do because it's not feasible. We've been doing this since March, and it is depressing. I think, it's depressing to be in house, nothing to do, no goal. And that's what the other thing is when I'm not working, literally a lot of times I have nothing that I have to do, which is not normal. I mean, my life was very hectic before. And
So basically, thank you so much for sharing so far. And so what do you recommend? I have an office, a primary care office, and I'm struggling day to day. Do I stay open? Do I close up? I mean, everyone has a mask on. My employees have a mask on. We've cut down the population. There's only 2 people in the waiting room at the same time. So we're doing half telemedicine, half in person. I mean, I feel there's value in continuing preventative care and continuing the checkups and the annual exams, and that's important. And just taking all the precautions you possibly can. And we're constantly learning, as you said.
Right. Yeah. That's actually a good point because that's what they've noticed with the cancer patients. While the cancer patients aren't being affected per se by COVID infections necessarily, like you think they might be, thinking that a lot of them have they're immunocompromised and don't have a strong immune system. What really is hurting them worse is the fact that they're not getting the treatment that they need. People aren't getting to their doctors, they're not getting diagnosed with the cancers and getting plugged into what they need. So that is the ripple effect of this, So it's very important that we try to continue doing as much as we can for a normal life, but do it smartly, be aware, and again, the mask, the mask, the face shield, the glasses.
The face shield, the mask, even the goggles you mentioned, these goggles that look almost like swim goggles.
Right.
They create a seal, and you can get those at Home Depot, you said. That also helps with that.
Right, yeah. And it's interesting, and people are always also concerned about going back to school, what happens then. And it's funny because I saw, it's really more of it's the major issue, I think, for the going to school is the fact that kids, they're vectors. They spread everything. I mean, lice and the whole 9 yards. It's really difficult. And especially the younger kids who really need to go to school, who are also a bigger risk and bigger concern because they're not reliably going to wear the mask. And it's funny because I saw the other day a little kid, he had a mask on that went like this. And then he had a modified baseball cap that had a visor, clear visor. I'm like, that's really doable. That really could work,
You can get creative,
we're going to have to get creative. We're going to have to get creative, you know, because the other thing is that the whole thing with the school issue is that it's not just the education, which we've also seen has dropped because, you know, some people aren't teachers. I think that teachers, you know, answer a calling. Not everybody can be a teacher, you know, and I think that, you know, there's also people that rely on it to go to work. They rely on their kids going to school. And there's also a lot of people that rely on school for food. So we're going to have to try and figure out, you know, this next month, how we're going to, you know, work on that. And I don't have, you know, the perfect answer for that. But again, I think we should be practicing the things that do work, which is wearing the mask, finding a mask that works and that fits. Because the problem also that we're seeing with people wearing masks is that they're not wearing them correctly, or maybe they're too tight and they're getting sores across the bridges of their nose and their cheeks and behind their ears, which is a huge problem because there's not a lot of fat here. So then you get problems with that, and then you also get problems with then infection. And then, so you got to be really careful. Make sure the mask fits, make sure it's comfortable. Same with the eyewear, you know. So
it says here, is fatality rate decline attributed to better treatments?
I can't say that I know. I don't know if the decline is. I would say yes. You know,
now you guys have a better idea of what to give them, what not to give them.
I mean, there are some medications that we're using, you know, IV vitamin C, remdesivir, the plasma transfusions. You know, there are obviously some very aggressive treatments that we're trying to use with these patients. So yeah, I mean, people are surviving this.
Right, people are surviving it more than they were before because we had no clue, and but now we have an idea of how to manage it in the emergency, right?
Yes, not as much as we'd like, but yes, it is still, you know, still a lot of unknowns.
We'll probably be talking again periodically to get an update of the front lines. Do you recommend wearing a face shield when going out to do groceries?
I recommend wearing what you feel you need to wear to feel comfortable.
I would say yes.
Yeah,
I would say just say yes, especially because you asked the question number one. So intuitively, also you feel you're protecting yourself, because you just have to assume that other people are not using the best judgment. Other people are leaving their homes symptomatic, you know, sneezing, coughing, unfortunately, and you have to take the precaution. You have to assume, right? And,
but it also has to be. It also has to be doable because, you know, we were coming home, you know, today driving, and I saw somebody jogging with a face shield on, and they started giggling. I'm like, that.
Yeah, if you're jogging and people are 6 feet away from you,
not even 6.
You don't have to wear anything.
Like 30 feet. There was nobody within this. I'm like, this person is running in this heat. I'm like, how is that working for them? You know. So, but shield and mask together. Yes, I mean, you know, do I do that when I'm not at work? No, I don't. You know, but that's, again, you need to do what you feel is, you're comfortable doing, you know?
Right. And I'm going to talk more again on Wednesday, and I'll talk more about like some preventative care stuff. This is Dr. Dabal. She's on the front line. She's in the emergency room, and she's actually treating COVID-19 positive patients. And somebody's on the latest.
And somebody's asking a good question about recommending getting tested continually until they become negative. There isn't really a point to get tested continually. I would say when you've had symptoms, you're tested positive, you've had symptoms, their symptoms are gone, you need to have 2 negatives within, the day in between to say that you're truly negative again. So, and a lot of people will need that to return to work and stuff like that, So that is that's a true negative, is, having a negative test after your symptoms have resolved, and then a repeat negative.
Right.
Yeah.
Thank you so much, Karen. I think we're going to meet again at least once a month. I think you're a wealth of information. You're on the front lines.
Yeah.
I'm going to definitely check out that YouTube channel, MedCram, CRAM, MedCram, doing the studies. Knowledge, I think, is power. Knowledge does ease us and soothes us, and knowing empowers us to feel and make our own decisions with the information and use our best judgment. And I'll be on again Wednesday at 7, and we'll talk a little bit more about vitamins and supplements and other things we can do preventatively, right? Karen's out there in the front lines. Thank you again so much for being out there. It is in your heart. It's all the healthcare providers. I believe it's in their heart. It's in their calling. They're called to just do what it takes, do what makes sense, and be there to serve, right?
Yeah. Yeah, I
I know
definitely
you love
think,
what you do.
yeah, and so do my colleagues, because let me tell you, there's been some scary times, and, you know, they've been amazing. They've really been
And they've
amazing.
been, yes, they've been,
Yeah.
and thank you so much. It's an honor and a pleasure to be your friend and your
Ditto.
colleague. And I
Yeah.
hope that you join us again in the future. Thank you
Yeah.
so much, Dr. Duvall.
Take care.
In great love and gratitude to you. And we will be in touch. Thank you, everyone, for
Okay.
joining us tonight. And I'll see you again Wednesday night at 7. Thank
All right. Take
you.
care. Bye.